This video is a guide to your post-operative care following the SASI bypass. We'll start by discussing your diet. As you know, the surgery creates a long, thin tube-like stomach which we then join on to a loop of your intestines. And it's quite natural after surgery that the tube will swell a little, and so it can feel quite tight. It's important, therefore, that oral intake be gradually introduced, otherwise you could experience pain or perhaps even have an emergency situation if something was to get stuck. Once you return to the ward, you can have ice to suck and sips of water. At this stage, it's really about mouth comfort because you'll be getting plenty of fluids through your drip. On the day after surgery, you should transition to taking all of your fluids orally so that you can be weaned off the IV fluids. It's important that these fluids are thin fluids, which means you could drink them easily through a straw. It's okay, therefore, to have cups of tea and coffee and thin soups, etc. Please order up a protein energy drink, something like Sustagen or Ensure or Resource from the room service menu. Ask your nurse for help if you are struggling to do that. You'll be on thin fluids when you go home and for about 7 days. You'll be able to go home when you're comfortable and drinking okay, and that's usually the afternoon after surgery or the morning after that. After about a week of thin fluids, you should be ready to transition to thickened fluids, something like a thick pumpkin soup consistency. You know it's a liquid because it would run out through the drain if you put it in the sink, but it won't run obviously as fast as the thin fluids would. You can take a lot of food and blend it with some fluid to make it into a puree at this stage, so it can be a bit more interesting than the thin fluids phase. Please stay on the thickened fluids for about a week. After the thickened fluid phase, you can gradually introduce some soft foods. This is often referred to as the baby food stage and includes foods like mash, scrambled eggs, foods that would be served up to somebody who didn't have teeth. There should be no need to chew the food. Stay on the soft foods for about a week. Finally, you're really ready to introduce any food. As long as the soft food phase wasn't going too challengingly, I'm very happy for you to start to introduce chewable food at this stage. My advice is to go slowly and maybe start with food that's easily chewable and probably in a sauce so that it's lubricated. Any foods that have previously gotten stuck when you've swallowed them too quickly should be avoided at the beginning and introduced only very slowly. Try to eat sitting down at this stage. Cut the food up really well with your knife and fork and then chew it well so that it's no more than a bolognese sauce type consistency before you swallow it. When you'll go home with some Nexium. Nexium's an anti-acid tablet. It helps to prevent ulcers developing at the joint. We know that this is a possibility, and so for 6 months I'll ask you to take Nexium. You'll get 4 weeks supply when you leave the hospital, and when I see you in follow-up, I'll give you a script for the rest. You should have an appointment with your dietitian a week or so after the surgery. The dietitian will reinforce the need for you to have adequate protein intake and remind you to take multivitamins. You don't need to take multivitamins straight after surgery, but you do need to start them within a week of the surgery. They can be chewable or in capsule form. NutriGI are a local brand available on the internet that are designed for patients having this surgery and don't have too much B6, unlike some of the common brands that you might see in the chemist. When you wake from surgery, there will be dressings over the wounds. These dressings are waterproof for the shower and they stay on for about 9 days. They might occasionally need changing before you leave the hospital if there's a bit of ooze under this dressing, and the nurses will attend to that. Underneath the dressings are buried and dissolving stitches that don't need to be removed. So after 9 days, you can peel the dressings off as you enter the shower and just let the water run over the scabs at that stage without rubbing at the wounds. You won't need dressings after that unless one is a bit weepy, in which case a band-aid after each shower until it's dry. Exercise is important after this surgery because as you lose weight, otherwise your body would reduce its own muscle and bone. Exercise keeps you healthy and strong as you lose weight. You can walk straight away. Even on the day of the surgery, take the opportunity to walk around once you're up going to the bathroom and increase your activity each day. Once you go home, make sure you go for walks and stay hydrated, particularly on hot days. You can lift things, but be guided by pain. Don't do anything too adventurous for about 6 weeks. I need to see you again around 3 to 4 weeks after surgery. If you don't already have an appointment, then please call or email us to organise it. In the rare event of any major concern or emergency, you can call the Mater Hospital on 99007300 and ask to speak to the charge nurse. They'll put you in touch with me at any time. I hope your recovery goes well. I look forward to seeing you during your post-operative stay, and you can later on refer back to this video or your post-op printout anytime you need to.